Okay, so I think we're going to go ahead and get started. Thank you to everyone who's taken the time to join us today, and special thanks to our phenomenal speakers who are joining us today. My name is Figueroa, and I'm a senior staff attorney at Farmworker Justice. For those not familiar with our organization, we are a national advocacy organization based in Washington, D.C. that seeks to improve farm workers' living and working conditions. We advocate on a broad range of issues, including immigration, labor rights, educational, occupational health and safety, and access to health. A few housekeeping matters before we begin. We kindly ask that if folks have questions that they'd like to ask, they wait until the end of the presentations. And please enter your questions in the chat box so that we can be sure to get to them. Also, an important disclaimer that this webinar is supported by a cooperative agreement with the Health Resources and Services Administration of the U.S. government. However, the content of this webinar does not necessarily represent the official views of, nor an endorsement by HRSA or HHS. Today, we'll be focusing on an issue that's at the intersection of the various challenges faced by farm workers, preparing for and responding to natural disasters. Climate change has increased both the incidence and severity of natural disasters, such as wildfires and hurricanes. It also has contributed to increasing temperatures, which can lead to heat stress. Farm workers are often asked to continue working even in the face of these threats. They are also among the communities most at risk of displacement, adverse health impacts, and economic insecurity resulting from these threats. But unfortunately, farm workers are not always at the forefront of state and local responses to natural disasters. There's often a lack of knowledge about where farm workers are located and lack of information available in the languages that they understand, just to note some examples. At the same time, farm workers may be hesitant of contact with state or federal authorities due to fears or discriminatory treatment they've received in the past. We will soon be hearing from two speakers with years of on-the-ground experience in preparing for and responding to two specific types of natural disasters, hurricanes and wildfires. Before we turn to these state-specific experiences, I do want to briefly highlight some efforts at the federal level to address some of the issues we'll be talking about today and the absence of federal protections for many of these risks. The first is a bill called the Farm Worker Smoke Protection Act, which calls for the Occupational Health and Safety Administration, or OSHA, to issue a federal standard protecting farm workers from wildfire smoke exposure. It would require the provision of masks, as well as adequate training and education on proper mask usage and health impacts of wildfire smoke in a language understood by workers, among other provisions. The second is the Asunción Valdivia Heat Illness and Fatality Prevention Act. Although named after a farm worker who tragically died from heat illness, the bill would apply to all workers. It would similarly require OSHA to issue a federal standard for protections from heat stress with meaningful participation of covered employers and their representatives and tailored to the specific hazards of the workplace. These bills or similar efforts may be introduced in the next Congress that will be starting in January of next year. Farmworker Justice is also involved in a broader coalition of farm worker and environmental advocacy groups regarding different proposals related to climate justice and the best ways to address the underlying causes of climate change that are exacerbating some of these risks. Additionally, we have a series of brochures regarding different types of federal assistance available after natural disasters. These brochures are available on our website in English, Spanish, and Haitian Creole. And we'll be posting some of the links to summaries of these bills, as well as links to these resources in the chat box in case people are interested in accessing those. They are also available on our website. So I don't want to take any more time away from our speakers today. So I'll start by introducing our first speaker, who is Herminia Ledesma. Herminia is a program manager for Vista Community Clinic, or VCC, where she oversees VCC's migrant health and community engagement programs. She has worked in a variety of roles within the agency and has extensive experience leading community health worker efforts. In her current work, one of the biggest efforts is supporting the work of Poder Popular, VCC's legacy promoter group, working with over 40 líderes in the city of Vista on health equity advancement. She serves in multiple leadership positions in the community, including co-chair of the San Diego County Promotores Coalition, vice chair of the Farm Worker Care Coalition, member of the San Diego Food Vision 2030 Steering Committee, and member of coalitions such as the San Diego Binational Health Week Coalition and the Resident Leadership Academy Council. So Herminia, you obviously have a very full schedule, so we really appreciate you being with us today. Please go ahead.
Thank you, ladies. And if you wouldn't mind sharing my slides, or I can share them myself. And I can just start by sharing a little bit about our organization. So as Edie's mentioned, for me, it's morning. So good morning to everyone. Good afternoon to everyone who's in the East Coast. My name is Herminia, and I work for Vista Community Clinic, who's a fiscal sponsor for Farmworker Care Coalition. And these two organizations are really at the core of our emergency preparedness efforts that are coalition-wide, but really primarily facilitated by a lead agency. And I'll share a little bit more about our work. A little bit about Farmworker Care Coalition. It's a coalition of agencies who've come together to make sure that our farmworker community in North County, San Diego is cared for and supported and is given the resources to thrive. And Vista Community Clinic, the fiscal sponsor, like I mentioned, is a federally qualified health center and a migrant health center. And we support our migrant community through various ways, which I'll share more as well. Next slide, please. So our, as you all know, emergency preparedness is what brought us here today. And in Farmworker Care Coalition and the work that Vista Community Clinic does, we've structured our areas in three kind of bigger buckets in terms of how the coalition has worked. And Farmworker Care Coalition was actually, the inception of it was around emergency preparedness because we saw the need, and living in California, wildfires is something we have to deal with, unfortunately, pretty constant. And we've structured our efforts in three areas, focusing on disaster preparedness, education, and public health, and really seeing how all of these areas interconnect and intersect as we do the work of emergency preparedness in the community. Next slide, please. So I'm probably preaching to the choir a little bit here, but I just still wanted to mention some of the really unique aspects of serving our farmworker community in San Diego. And when I'm sure as many of you think about San Diego, you think of ports, you think of the border region, but actually North County, San Diego houses a lot of agricultural work, which is where we're housed. And we have a lot of avocados and citrus groves, as well as farmworker communities that have unique needs. We're still within the 100 border region, or 100 mile, that's considered a border region. And so that really affects ICE presence and immigration status, and as a stressor and added vulnerability. Some other vulnerabilities that affect our farmworker communities are isolation. Our farmworker populations are really located in more rural areas of the county that often lack the same resource or the same access to resources as our other communities, employment, health status, and then of course, structural inequality, lack of services, exclusion, racism, and lack of awareness of our service providers of the unique really needs and to be able to provide adequate service. Next slide, please. So the way we do our work, and I'm sure you all are familiar with the promotor model, although we actually do not call our promotores, we actually call them líderes. So our líderes comunitarios are really the heart of our work and how we achieve both emergency preparedness, but also just health promotion and health education out in the community. Our group is called Poder Popular para la Salud del Pueblo, and it's a group that was actually founded over 13 years ago, working on HIV prevention in the field, but also working on emergency preparedness. So as you can see, you see some of the pictures of them in action at health fairs, conducting focus groups, and providing health services with one of our volunteer doctors out in the field. And Poder Popular has really enabled us to keep the trusted messenger and really the trust in our community. I think all of us realize that we're living in some interesting times, and Obviously, political climate is of top of mind lately, and so our leaders have really remained active for those 13 years since the group was founded, and have really enabled us to really grow and capitalize on the trust for the benefit of the community. Next slide, please. So just to give you a sense of kind of what are some of the emergency preparedness issues that have afflicted our county, although this dates back to kind of what prompted our work and really kind of shifted us into gears and allowed us to learn some lessons. In 2007, San Diego suffered North County San Diego, I should say more specifically, suffered some of the largest fires in the county. And it was a total of 8 fires that burned for 10 days and burned more than 368,000 acres and destroyed 1,751 homes, including in those homes were housing provided to farm worker populations in the area. And so through these efforts was what really launched our focus on emergency preparedness and ensuring that our communities were prepared and informed about what could happen. Next slide, please. So some of the things that we learned both in the 2007 fires and then other fires that happened in about 2010 is that regarding preparedness and evacuation, folks were under-resourced. And there's poor infrastructure and unrealistic recommendations for preparedness, right? And I think I'll share a little bit more in terms of how we're seeing this throughout the pandemic, being that it's our most current emergency. But one of the things that we saw is in terms of under-resourced, folks who needed to evacuate didn't always have access to transportation, so no access to a car, and also not provided central transportation to be able to evacuate groups of people. In evacuation, one of the biggest barriers that communities faced was evacuation language or messaging in Spanish. So translated live, provided by secured officials, so our county, our Office of Emergency Services. And one of our biggest barriers was some of the fires happened near our military base. So, and that was actually an evacuation route that our county designated. And so, folks who didn't feel comfortable going on a military base were unfortunately not able to evacuate. And that was some of the messaging that we worked around with the county to ensure that all of those issues were taken into account. So again, with transportation being a barrier, distance, routes, all of that really matters to community members when we're trying to talk about emergency preparedness. Next slide, please. And the same, unfortunately, goes for relief. So part of our model really sought to inform this portion of it, partly because in shelters we saw there's a lack of sensitivity, racism, language, lack of information, eligibility, and not so much that shelters required it, but folks perceived eligibility for accessing these services and then needing to move around. There was a total of 8 fires in 2007 that required active movement of those shelters, and could folks keep up with that? And then communities outside of our shelters that couldn't access those services were paralyzed, and again, transportation barrier because of the size of our county ended up being one of the top areas, which you've already heard me mention a couple of times, and that's because it was what was front of mind for folks. And I think some of the things that we're still seeing now is just ineffective response from relief agencies. So is the messaging being translated in all of the languages that we needed, and how do we work on that? And since our county has done a lot of work to address these issues, which I'll be able to share in a little bit, but during the 2007 fires, these are all the things that we learned. Next slide, please. So a little bit in terms of how a fire emergency preparedness and kind of disaster response relates to our COVID-19 work. In our current efforts, we're seeing just a lack of cultural sensitivity, so inability to self-isolate. So self-isolation being a key to really putting a stop to the pandemic and slowing it in its tracks. But how feasible is that for the community? And we're not just talking about space, but it's also our folks, primary care providers, and can't self-isolate because they're caring for their family members. And so inability to access work sites and having agricultural sites allow service agencies to come onto their work campuses to really inform. We know that having a captive audience is a best practice in terms of how we deliver messages. And unfortunately, we haven't been able to go back to our agricultural partner sites to really be able to make sure that we're actively reinforcing messaging, right? And making sure that folks have access to that information. Lack of PPE resources, ineffective response. One of the things that we know in our farm worker and migrant communities is that in-person one-on-one outreach is always some of the best way to provide information. And so without the ability to do that, there's a sense of doing more passive engagement that oftentimes doesn't result in the type of efforts and engagement that we want from the community. And then barriers to testing, lack of updated information. We know testing is happening live. How fast does that get out into the community? And then the nuances of testing, right? Who's getting tested, who doesn't, who has active symptoms versus who doesn't. And all of that, it adds just to the depth of the message and us needing to reinforce it as service agencies. And then again, transportation barriers. So without really having community facing testing sites that are walking distance from target areas in the community, folks still have a hard time accessing testing, not just for transportation barriers, I would say, but also having to compete with their work schedules and so on. And then structural barriers, so offering testing at local law enforcement sites or offering testing during working hours are some of the structural barriers that we've seen that really prevent folks from accessing testing. Next slide, please. So what have we done to really respond to all of these things? After 2007, Farmworker Care Coalition and Vista Community Clinic, along with our partners at National Latino Research Center at our local state university, created a plan specifically for response in farmworker communities. And it really captured all of the strategies you see here. So community involvement and networking, making sure that the community voice as this plan was developed was a big portion of our work, making sure that we had a community-led advisory board, partnerships, advocacy, assets, and capacity. And then one of the biggest ones was buy-in. And this plan is actually being actively updated as we speak. So this happened over a decade ago, and we're now looking for funding to be able to bring this and update it to really be able to also add things that we've learned from the pandemic. Next slide, please. But this is a resource that we can make available to you all. Some of the focuses are disaster preparedness. And so these are kind of what was actually in the train the trainer education process that we shared with our líderes, and the actual information that we shared with folks. And the picture you see here of the American Red Cross backpack was our efforts were actually coupled with American Red Cross education. And all of our líderes comunitarios, after getting trained, were actually given their shelter card, and actually were able to then be volunteers at those shelters where we wanted to address the access to both trusted messengers and language in our shelters. Next slide, please. A little bit about what's in the plan and kind of how we respond to it live. So aside from creating this plan that Farmworker Care Coalition is actually working on and deploying, we created what's called a Farmworker Care Coalition incident command structure. So once a local emergency happens, we activate this incident command center, and the chair actually is the one overseeing all of these efforts. And there's, hopefully you all can see it, but if not, I'm happy to share slides at a later time. There's a lot of different efforts that are activated. So lead operations is activated both from Farmworker Care Coalition and Vista Community Clinic. We have field coordinators, so local agencies who are part of the coalition who support the field coordinators. And then our líderes comunitarios who have remained a constant through all of our project and also are part of the community, act as reporters in terms of what's going on in the communities that we're serving. And then also how, they're delivering, they help us get the message out via text messaging, their social media, and so on. And so once this happens, we keep this incident command center open for as long as we need to, and we monitor the situation. This could mean making sure that folks have access to water, to PPE, to getting transportation if we need to. So we're often responding to things live when we're able to. In one of the fires, because we're an emergency partner with the county, we were able to get access into a city that actually has very little evacuation roads or limited evacuation roads. And we were, as a partner, granted access and we could go deliver water. And so those are some of what it looks like live when we're updating this emergency preparedness plan. And if we can go to the next slide, please. So some of the things that we hope to respond to and that we're seeing now with COVID is folks still having limited access to healthcare, mental health coping issues. I know that's a really big one for during COVID. Folks are isolated or have lost their livelihood. They lost their work or lost wages, and that really has affected them. I'm sure no surprise to anyone who's in California, but housing came back as folks' number one concern during COVID, and also is the number one concern when folks are evacuating. So, if they lost their home, how will they get access, and more for scarcity, but also costs and inability to relocate. And some of the bigger things that we also see in our farmworker community is our asthma and respiratory issues. So we know that during the fires, that's a big concern, making sure that folks who need access to appropriate PPE to make sure that they keep safe, do so. And then, of course, access to food and water, which is one of the ways that VCC chose to respond during both COVID and fires. We actually designated our food distributions to, instead of a one-day walk-up food distribution, we actually now have a month-long access to food, and we actually drop off food at local agricultural partner sites where we work with our líderes to gather folks and let them know that we're coming, and we bring despensas for 50 to 100 families, how many ever requests we have for that week. And so that's something that we're continuing to do live, just because we know that we can't answer all of the things related to really supporting the health and livelihood of our farmworker communities. Next slide, please. So just so that you all know, other things that we do aside from activating our plan, making sure that our partners are involved. During the 2007 fires, the coalition leveraged over $500,000 to fund farmworker families who were affected by the fires, and that was to rebuild housing, cover healthcare expenses, provide rental assistance. And we know that due to immigration status, families are unable to qualify for FEMA resource and so on. And so this, of course, didn't answer the call to meet all of our community needs, but these are some of the things that, additional to all of the other efforts that we were doing, we were able to support communities with. Next slide, please. And then currently, we actually just wrapped up this project. Since the inception of COVID, Farmworker Care Coalition was able to leverage $300,000 garnered from donations from various partners from throughout the state to make sure that our farmworker and migrant families had access to support if they were affected by COVID. So loss of wages, coverage of healthcare expenses, rental assistance, which again, key in this time period, and then food and clothing and school supplies. As schools are opening up in California, families really weren't prepared or didn't have the same resources. And as one of the call outs for us was school supplies and responding to that. So that was a little bit about what we did in response and how that really works towards our plan. So our plan really focuses on the aspects of emergency preparedness and education. And then we also did partner leveraging. Next slide, please. And I think that's it for my part. Thank you so much.
Thank you so much, Herminia. As a reminder, if people have questions for Herminia or just in general, please feel free to type them into the chat box. Our next speaker is Lariza Garzon. Lariza is the Executive Director of the Episcopal Farmworker Ministry of North Carolina. She was born in Bogota, Colombia, and moved to the United States, where she attended Stetson University in Florida. Lariza has been working with farmworker communities since 2004, when she was still in college. She is passionate about food production systems and farmworker justice.
Thank you, Iris, and thank you everybody for being here today. I'm really excited to share our experience with disasters and with COVID here in North Carolina. And I also have a PowerPoint presentation, so we'll share that on the screen. Before I begin, I'd like to tell you a little bit about the ministry. So we are a small ministry of 2 dioceses here in North Carolina. We have 4 full-time employees, and our mission is to provide direct services, community education, leadership development, and advocacy. And we work with Latinx immigrants in the rural areas of the counties that surround our office. Most of the people that we work with are agricultural workers, which means that they work in the fields or in meat processing plants or in packing houses, nurseries, or farms with animals. And we really didn't have a formal disaster preparedness response or recovery program before 2018. 2018 is when we had 2 big hurricanes here in North Carolina, Florence and I want to say Michael. I'm blanking out for some reason, but anyway, we didn't really have a formal disaster program, but the gap of services and resources available to the community was huge. And so we felt that we had to fill that gap and make more resources and information available to the community. And that's kind of like how our program started. 3 days before Florence, that's when I started to work in the ministry. I didn't really know a lot about disasters, but I did know, because I was very connected to the farm worker advocacy world, that people didn't really know that the storm was coming, especially H-2A workers, which are the workers that come here with a guest worker visa. And they tend to be the most isolated workers here in North Carolina. We were hearing that they didn't know that there was a disaster coming. And actually, as of Monday, the Monday before the storm, when doing outreach, that was the case. And so on Tuesday, Monday was my first day. On Tuesday, I wrote a grant anticipating that the storm was going to be huge. And on Wednesday, the storm landed in North Carolina. And as we expected, the storm was over the state for a long time. It was a storm that lasted for a long time. And that next Saturday, we were already doing outreach, trying to figure out what was going on. And what we found is that, the people who were the most vulnerable were the most affected. And so we heard stories about farm workers who had to ride the storm inside of a school bus because they were never evacuated. We heard about farm workers who called 911, and 911 spoke with the grower, and the grower said everything was fine and their camp was flooded. And so they had to be helped by nonprofit organizations, and we had to provide them with some aid. We heard so many different stories that really reflected the fact that people were not prepared for the storm and that they didn't really know where to get help after they were affected. And so we started with what we call the response, which is basically what you do immediately after a storm. We can go to the next slide. So after the storm, basically you do outreach to assess the need. We partnered with other organizations, and over a period of 6 weeks, we ended up delivering aid to over 4,000 workers, most of them H2A workers, because as I mentioned before, they don't have their own transportation. They're living in isolated areas. Many of them come here for the first time, so they don't really know how the system works. There's a language barrier. So what did we do? We worked with other organizations that were already doing outreach to farm workers who wouldn't have such a hard time like navigating the roads, because many roads were flooded. So we needed some people who could say, okay, this is flooded, I'm going to turn around and I'm going to take this other route or whatever else. We provided hot meals to people that didn't have power, water, food, hygiene items, air mattresses, different things that people needed at the moment to be okay. So as we were doing all these outreach to H2A workers, we also realized that the seasonal workers, the population that lives here year-round, was also struggling. And we started to provide them with this type of aid, but also when we were doing outreach, we were kind of documenting the other types of needs that they had, to try and see if we could do something about it. So after this period of 6 weeks, we started our recovery efforts. We can go to the next slide. And the recovery efforts are still taking place today. This home repairs amount has to be updated because it's higher. But yeah, recovery efforts were basically a community effort. So we would go, for example, on outreach, and somebody would tell us, oh, there's this guy over here who's living in a trailer that got a lot of damage because of the storm. You should talk to him. And we would go and find out what this person needed. And this person would, you know, tell us about 10 other families. And that's kind of like how we started working in terms of like finding people and figuring out what their needs were. And we ended up working in 11 different counties. The main thing that we did for recovery efforts were home repairs, finding medications for people, helping migrant workers travel so that they could go back home, because when they came here, obviously there wasn't a lot of work. So also replacing furniture and appliances, and just kind of like helping people get back to like a semi-normal state. But when we were doing this, there was two things that were really interesting. Well, three. One is that we were able to identify natural leaders who were in the communities, who were kind of like organizing their communities in a very organic way. And we knew that they would be key for the community to recover. So that was the first thing. It was like noticing all the talent and all the leadership that already existed in the community and the resiliency of the community. The second thing was that not long before the storms, there had been some raids here in North Carolina. And so we noticed that the mental health crisis was huge between those two things. Some people had lost their home, their jobs, their vehicles all at once. Some people had never experienced a hurricane before. Some people, you know, were trapped in farms. There was just a lot of trauma. And so we identified the need for mental health services and made sure that that became a priority for our program and our recovery efforts. And then the last thing was that we noticed that even when services and aid was available, people were facing lots of challenges to access those resources. And so, you know, the speaker before me, Herminia, she spoke about the isolation, the language barrier, the immigration status, like all these different aspects that make it hard for people to get the help that they need. And so, as we were working on our recovery efforts, we actually said, okay, we need to implement a program that will help us address all of these things that we're identifying. And so we can go to the next slide. I guess one thing that I forgot to mention is that recovery efforts are still taking place because we're working with a very vulnerable community that earns poverty wages. And so it's really hard for them to save money or to pay for things that are outside of the budget. And so recovery takes years to happen. Just last week, we had a call from a woman who was sleeping in her bed and her bed fell to the ground because that's how rotted her floors were. And so it just gives you kind of like an idea of like, it's been 2 years and people are still living without appliances or in very bad housing conditions. So as I mentioned before, one of the things that we realized is that there was so much resiliency and leadership in the community. And so we started a program for peer-to-peer relevant, culturally appropriate education regarding disaster preparedness. And this is how our Promotores program happened. In the first part of the program, which was 2019, we had promotores go door to door to trailer parks where they knew that a lot of vulnerable families lived, or different neighborhoods or areas, and they provided information. And there was also, they would go to community events. So for example, if there was a park where a lot of people, Latinos, played soccer, then they would go and they would table there, or Christmas events or schools, anywhere they could go, they would go and they would distribute information, and they would distribute emergency kits, and they would ask people what their needs were. And so just in the very first part of the program, they visited 158 families, and they did 350 phone calls asking people what their experience was. They attended events and collected information from 80 families. And so we realized, like, wow, there's all these needs that we're not even considering. These promotores, these leaders in the community became the eyes and ears of the ministry. So like the bridge between the community and the organization. And that was important too, because we knew that with a four-person staff, like we knew that we were not going to be able to provide all the services and all the information that people needed, right? And so we knew that advocacy had to be a huge part of what we did. Like things needed to change from the root so that in the future, people didn't need to go to us for basic things. So these community leaders were trained on how to distribute, information and help people in their communities, but also we were thinking about how to integrate them into our advocacy efforts so that the community could advocate for its own people. At some point, we also partnered with another organization and we did 5 focus groups. And so between the surveys and the information that the promotores were giving us and the focus groups, we came up with the biggest gaps of information that people were having. And we decided that we were going to do a training focused on those things. And we wanted like practical information, not just general stuff, but very useful, detailed stuff for immigrants in Eastern North Carolina, so that they could really use the information and get the services and resources that they needed. So we can go to the next slide. So with that information about what the gaps were, we started creating printed and digital educational materials. For example, like this one is from the last hurricane, which was Isaias a few months ago. And we knew that one of the biggest issues is most people live in trailer parks. We know that trailers are not made to sustain winds. And so we were encouraging people to leave their trailers and seek shelter somewhere else. And also because of COVID, we knew that shelters were not going to be accepting as many people. And so we were asking people to look for friends and family in low risk areas before they went to a shelter. And so we started putting together all these materials that were targeting the specific problems that people had identified. Because of COVID, we also couldn't do our in-person trainings. We had programmed, like we had scheduled train the trainer trainings, and that was not happening because of COVID. So we can go to the next slide. So we decided to do those trainings in person via Zoom. And at first we thought that was going to be impossible because we know that our community doesn't have a lot of access to computers and internet and, you know, all that. But what really helped us is that most people have children, and most of the children had to take classes online. And so it created this situation where people had to learn how to use the technology, and then we would just provide a little bit more support so that they could become experts on how to use it. And our trainings have happened since, I believe, since June or July. They happen every Monday, and we get between 30 to 50 people in every single training. So I think for us, that was a huge victory because we are building leadership and increasing people's skills at the same time. And it has allowed people to learn a lot about different things regarding disasters. And we know that they're sharing this information with other people because a lot of referrals have taken place after these trainings. And then, you know, we also have been distributing information in person. So with COVID, that became a little bit more difficult. We couldn't go door to door, but we do have different events where we distribute PPE and food and other type of aid for people who were affected by COVID. And during those same events, we make sure that we give people emergency kits, information about disasters, etc. So we can go to the next slide. And with COVID, things have changed a lot. So we're not able to go to camps the way that we used to before the pandemic, where we would spend a lot of time with people. Most of the time when we go to camps now, we're doing a lot of like dropping off donations and information. Excuse me. And then we do have community distribution events that take place twice a month. During these events, we distribute food, PPE, and information to between 200 and 260 families. Most of them work in agriculture. And so it's a really good opportunity to get people to be aware about the resources and the services that are available to them. And also, like, if we know there's a storm coming, just give them information regarding disaster preparedness. So, in addition to like going to camps and doing the distribution events, we are also going to meat processing plants and trailer parks where we know there's a lot of farm workers, because we believe that those are the people that are the most vulnerable and they're the ones who need the PPE more than anybody else. And we've been able to distribute like hundreds and hundreds of kits that way as well. I know that I'm rushing a little bit, so I'm sorry if I'm speaking too fast. I just kind of want to make sure that we cover the advocacy piece, so we can go to the next one. So after Florence, we have a coalition of organizations here that work in support of farm workers. It's called the Farmworker Advocacy Network. And there was somebody in legal aid who actually took the time to survey all of the organizations that were providing services after the storm in 2018. And this person put together a toolkit with other members of the coalition. And our experiences were kind of documented in this toolkit so that in the future, other advocates would know what were the main challenges or the successes that we had after a huge hurricane. And so you all can download this disaster preparedness toolkit if you go to the Farm Worker Advocacy Network website and you go to resources. There's like an info sheet, but there's also like the full kit, which I suggest if you're interested in storms and disasters that you look at it for sure. And then the other piece of the advocacy is that we have been able to build the leadership of those people that we visited, who were pointing us like to like this senora over here, like she's diabetic, you need to help her with this. Like those natural leaders, we invited them to become promotores, but also to become advocates. And so in many of the meetings that we have had with government officials or with different government agencies or even other nonprofit organizations, we've invited them to speak about their experiences, their needs, what they see in their community, because of course they're the experts. And we're hoping to bring that to the next level next year once the pandemic gets a little bit better, we get vaccines and stuff. So the only piece that I kind of forgot to mention is that we also work to do a lot of referrals, helping people navigate the system, helping them reach legal aid if they need to do, if their FEMA application was denied and they need to appeal, or if there's an organization at a local level that won't help them for X or Y reason. So there's a lot of that. And with COVID, we also started an emergency fund that helps only agricultural workers. Any North Carolina agricultural workers may apply. And we raised $320,000 to provide them with financial aid. We don't really pay the bills or do that because of our lack of capacity. We're only 4 people, but we provide them with a check with financial aid so that they can cover their expenses. In terms of how that has affected local farm workers, I would say for seasonal workers, the main issue is that they don't have enough work and they're not getting paid quarantine, and they don't have access to a lot of the PPE. And there has been some issues with testing here in North Carolina as well. So we're trying to support them. And then I think for H2H workers, for some people, the season ended early or the employers didn't plant as much. So we're just trying to provide them a friendly hand so that they can kind of be in a better place when this is all over. We can go to the next slide. Is this the last one? Yeah. So that's a really rushed summary of the work that we do. And my contact information is on the screen in case you want to contact me for any reason. And thank you again for this opportunity to present today.
Thank you so much, Lariza and Herminia, both for the presentations and for the amazing work that you do every day. We do have some minutes left for questions, and we do want to have the opportunity to answer any questions that folks might have or any additional information that would be helpful. So please don't be shy. Please go ahead and type in your question. I know I have some questions, so I'm going to use my point of privilege and ask a question. So I'm curious about, you both mentioned coalitions and, working with other partners and other types of organizations. What are some unlikely partners or allies or creative partners or allies that you have found to be helpful in this work?
For us, our funders. Like, our funders have been amazing, especially because we work with a national organization in the Episcopal Church called Episcopal Relief and Development. They have really trained our staff, supported our staff, connected us with other people. They have been really amazing. And we've had other funders who also want to support us, and they know that we don't have a lot of experience because we've only started this program 2 years ago, and they help us connect with government officials and with people who can make a difference in the lives of the workers. So that has been amazing. And I guess I'll say, like, our work, because there's only 4 of us, it really couldn't happen without other folks in the community who do outreach and who are advocates. So working with Migrant Ed, working with clinics, working with legal aid offices, all the people who are usually like interacting with the community, getting together during a disaster can really make a difference.
And if I could add, one of the things, and I echo a lot of what Lariza shared, and we have similar partnerships, so I won't go through that. either. But one of the things that we strive to do at Farmworker Care Coalition is make sure that our Poder Popular líderes actually sit at the table. And so they're to really facilitate the conversation, and thanks to Zoom and interpretation, simultaneous interpretation, we're able to facilitate these live conversations and have our líderes provide feedback about, you know, their experience as residents in the county that we're serving, but also as folks who really know the community and know what worked best. So at our coalition, we have Office of Emergency Services, we have the Sheriff's Department, which I think are unlikely partnerships, but actually there's a lot of data sharing and just communication that happens. And so we really want to cut the middle folks out, which is us, and really have our líderes at the table sharing what they know.
Great. And then we got a question about states that have wildfire smoke safety standards for workplaces. So one thing we should mention is California actually has some standards for wildfire smoke protection, and they're one of the few places that do. That's why we think it's so important to have a federal standard, because as with heat stress, again, California is leader. Not to say that it's perfect, right? But it's at least there's a standard in place, which is more than can be said for many of the states. And the person mentioned that Washington, and I believe Oregon as well, may be in the process of working towards a standard, but right now there's very few states that have one. So I'm curious, Herminia, if you've seen ways in which having a standard at the state level has been helpful, or, you know, still gaps that there might be even with the standard.
Yeah, well, I think part of the standard is just the state's resources for enforcement, and we do have a lot of just collaboration with the Ag Labor Board here in California. But I think what the reality in terms of accessing resources, even for both farm workers and farm owners. So we know that there's a lot of systemic barriers that even keep the owners from getting resources to their workers. And so one of the things that we ran into earlier this year, along with COVID and having wildfires at the same time, is the need for N95s. And we know, as we heard from San Diego County has a farm labor bureau, and it was reported, you know, owners themselves, because they tend to be, or contractors tend to be mom and pop shop businesses that don't have access to kind of the larger funds to really be able to supply that. So I would say access to resources, both for the workers in terms of getting it from the community, and then for employers to be able to offer them. And then I think with enforcement, I think that's more of a state gap, where regulations are good and inform how sites really need to operate. But then if there is even that flexibility in enforcement, then we know folks are less likely to adhere to the guidelines.
Thank you. And we got a very interesting question about your work with FEMA, specifically because, you know, in some immigrant communities that might be a source of not so positive experiences in the past. So if you could talk a little bit about that.
Well, what we encountered after Florence is that for a lot of families, especially those with mixed status, there was a lot of reluctancy to fill out an application to FEMA, even when people qualified. So I think that is just something that we need to be aware as people who are facilitating these processes. You know, if you just gotta respect, if somebody really doesn't want to do it, you try to find resources somewhere else. But I would like to say one of the things that helped us the most was to have partnerships with attorneys. We worked with the North Carolina Justice Center. They had an attorney that was basically available to help community members apply for FEMA or do appeals, as I mentioned, because I think what happens a lot is that people are so desperate after a disaster that they fill out their FEMA application, and sometimes they don't really know how to do it very well, or sometimes they're rushed, or sometimes they think they're doing the best, and they are, but a lot of the applications would get denied. And what we were trying to tell the community is that you don't have to leave it there. You can appeal, and there are people like this attorney who can help you with the appeal process. People did report some issues regarding mainly inspectors from FEMA that didn't speak Spanish, that would go to their homes, and it would be like a really frustrating experience for them. Or sometimes when the inspections took place, because of the language barrier, the inspector would never even make it inside the house. So that was something that we were trying to address as well. And our hope is that for the next disaster, things will be a little bit better, because now, first, we do have more experience, because that was like our first year dealing with that. But second, I think that we've also provided a lot of feedback and done a lot of advocacy. So we're hoping that at least at a state level, those organizations that work with FEMA will be more aware of the very unique needs of the population, and therefore there will be a better response.
And then, Herminia, I don't know if you had anything to add to the question about relationship with FEMA,
Yeah,
or other government agencies.
Right. I mean, government agencies, we have the Department of Labor who sits on our coalition, and then we have other local agencies. And in terms of working with FEMA, our relationship actually just started. FEMA kind of approached Farmworker Care Coalition saying they wanted to learn more about how they can better serve farmworker communities. So we're actually at the very kind of initial phase of starting that conversation. One of the things that they've done though already is supply PPE for our agencies and for agencies serving the population. So we're just starting that. So we're hoping that fruitful conversations come of this, and we're hoping to grow that more.
That's great to hear. We also got a question, and this is also a question that I had about alerts, especially, with the challenges with COVID, trying to think of alternate methods of communicating with workers, especially workers who don't speak English or Spanish. We know there's many indigenous workers, for example. So can you talk a little bit about, if you know of resources or ways that you've used in the past to alert about evacuations or about disasters, be it through the use of mobile phones or other sorts of methods?
So here in North Carolina, the emergency texts that the government sends that you can sign up for, they're all in English. So that is one thing that we have pointed out, but we also have our own texting program, I guess. So families can sign up to our text messages, and they receive alerts about disasters, but also about like resources available or programs or opportunities and stuff like that. I think that because of COVID, our in-person outreach has decreased. As Herminia mentioned, it's a lot harder, but we take any opportunity to provide printed materials. And also, in addition to relying on text messages, we rely on WhatsApp because it's something that immigrants use a lot. And we rely on social media as well. I would say that most of the people that we work with have Facebook because it's a way that they keep in touch with their families. And so that has also been a really useful tool. And for guest workers who come to North Carolina, they may change their phone number every time that they come to the state, but Facebook remains the same. So it's a good way to reach out to workers even when we don't have phone numbers for them.
And then, Minya, I don't know if you had any thoughts on the alerts.
Yeah, so very similar to what Larissa said, we also use WhatsApp with our líderes, and so that's just a really good medium. The one thing that we set up especially after the 2007 fires, and knowing that the emergency messages just go out in English if folks are subscribed to their message, our county actually took the initiative to create a platform, and it's a platform that they've redesigned to get all language experts on the same platform where folks are accessing. So language experts access the information live, and then they can translate it and share it with trusted messengers. the County of San Diego uses Partner Relay, and Partner Relay, for example, sends a message to language experts, myself being one of them. As a language expert, I get to take that message and then adapt it or translate it for the community that we're serving. We're trying to get creative, and we're actually looking to do just videos and other resources that we can do. We're playing around with technology a little bit because videos do take a little bit longer. But even with COVID, right, this is a pandemic that's been going on for a month, and there's very limited information that's been released in Mixteco or other indigenous languages, but we want to do more of that as a way to reach folks. But I think, the best way is always just really grassroots efforts, text messaging, WhatsApp platforms, and platforms that are attached to our Poder Popular Líderes or our Poder Popular Líderes have a Facebook page where we also update information there.
Great. Thank you so much. So we are at the end of our time, but I do want to thank our speakers and thanks to all of the participants and your great questions. We will be following up with the PowerPoints and some other materials as well. So we hope that these are helpful for folks, and please do feel free to reach out to get more information so that we can better serve our farm worker communities. Thank you, everyone.